Good morning to everyone. Today I'm going to discuss with you about communication or communicating bad news. And usually we call it as breaking bad news. But I would like to call it as communicating bad news because it's a skill. It's a kind of a professional skill that is really needed for all the professionals, not only to the medical, but also to any person. So we'll be discussing the importance of communicating bad news and the good way to deliver the bad news. So few facts before that. Communicating bad news is an essential skill for all of us, but we find it is challenging because we are not adequately prepared to deliver bad news, or we are afraid of delivering bad news because we are afraid of making the patients uncomfortable and their family, and we are afraid to harm our therapeutic relationship. But if you deliver the bad news properly, it will help the patient as well as it will improve the professional relationship. So it is important because many of us want to know the bad news in advance. And of course, we have a right to know that also. And if we'll get to know the bad news as early as possible, we'll be able to plan, cope, and set our goals and face the disease in a better way. And the relationship between the physician and the patient will improve as well. So there are so many different models of communicating bad news. This is one model. It is called 6-step protocol. So these are the steps getting started. And then first you need to know what does the patient know before you start giving something. And of course, how much does the patient want to know? Because some patients might not want to know everything. And then only you will start sharing the information and responding. Then after sharing, you have to respond to the patient and the family's feelings also. And then not to stop, but to plan the follow-up. So when you go to the first step, getting started has two main parts. The first part is, before you deliver some news, you have to learn or study what you are going to deliver. And you have to find a good setup where you can deliver. And then only you will start asking, what does the patient know before you delivering? Because if you are to deliver that the patient is having a cancer, as example, if you are trying to go here and there when the patient knows that he is having a cancer, it's going to be kind of a joke. So first you need to know what does the patient know, and then only you start from that point onwards. And how much does the patient want to know? Whether he wants to know or he wants you to deliver the news to somebody else, or whether he doesn't want to know at all, because he has a right not to know also. And then only you share the information, and the information should be clear and accurate, and it has to deliver in a compassionate manner. And then however you deliver the information, patient might start crying, might get upset, might get angry. Then you have to appropriately respond to the patient's and his family's feelings. And then you have to plan the follow-up. That is the part which we are usually forgetting. And there's another, actually there are few different protocols how you can break the bad news. The one which I just said is the 6-step protocol, and there's one called SPIKES. And SPIKE stands for setting, perception, invitation, knowledge, explore emotions, and summary. So we'll go into little details. Setting, as I said in the 6-step protocol, getting started, and in here the setting are both the same. First of all, you have to arrange some privacy, because usually in our hospital setup, there's no privacy at all. And it is very difficult to provide privacy. So you have to be very careful. If you are delivering a real bad news, you'll have to think about which kind of setup you are going to, in which kind of setup you are going to deliver the bad news. So you have to arrange some privacy, and you have to get significant others involved. That is, you should ask the patient which kind of, whether you would like to know the bad news, or do you want me to deliver the bad news to somebody else, or do you want somebody else's presence when I am delivering the bad news. And of course, usually in our hospital setup, we get to break the bad news in corridors while you are getting into the car, and that kind of places. Never deliver bad news in such a place. So you sit down, relax, and then only, if you know everything, or at least much of the problem, then only to deliver. Not just along the corridors. And first of all, before you delivering the bad news, you have to make the connection and establish the rapport. And you have to manage the time constrictions. When you have to go to a different other lecture, or like whether you have to, if you have to go for a surgery or something, don't deliver the bad news. Keep it for a good time, and prevent all the interruptions, including your cell phone, including the interruptions from your colleagues and the ward staff, and then only you are ready to go ahead. And about the perception and the seriousness, you have to know what does the patient know about his medical condition, or what he suspects. And you should know the level of comprehension, how he can understand, which kind of language he can understand, and which kind of situation he is. And if he is denying the situation, don't try to confront at this stage. You have to find a better time. And you have to have an invitation from the patient to give the information. You should ask which kind of details he would like to know about his medical condition or the treatment. And if the patient does not want to know, you don't need to deliver lot of news. And you can tell them that if you will have any other questions, then you can ask me later on. Like as example, if a patient is diagnosed to have cancer, it is not necessary to tell him about the chemotherapy and chemotherapy side effects, and then radiotherapy and what is radiotherapy and which kind of rays are involved, and all these things are not necessary at this moment. This moment necessary to deliver only the news that is supposed to be delivering. Don't bombard with lot of information. And about the sharing the knowledge in the 6-step protocol, it is called giving medical facts and the knowledge. You have to, like as Dr. Sandanayaka said at the very beginning, when you are delivering a message, that message has to be encoded in such a way that particular person will understand. Otherwise, you will not be communicating. That is why I said it is not breaking bad news, it is communicating bad news. Because if you will just break the news, patient might not understand, patient might misunderstand, the communication will not happen. So if you are to deliver something, you have to understand how you are going to deliver so that the receiver will understand. I can remember actually something that has happened in my internship. There was a VP who told the patient that you are having සිංහලෙන් කිව්වේ ඔයාගේ හදවතේ තුවාලයක් තියෙනවා කියලා. You are having some condition in the heart. So he wanted to say it that way. So ඔයාගේ හදවතේ තුවාලයක් තියෙනවා, ඔයාට එහෙම යන්න බෑ, discharge වෙලා දැන් කියලා. එතකොට ඒ patient කිව්වා කමක් නැහැ නෝනා, මම මේ ළඟ dispensary-න් බෙහෙත් ටිකක් දාගන්නම් ඒකට කියලා. හරි, එතකොට the language has to be so simple, but it should be clear enough to deliver the meaning. The information has to be given in small doses, not everything at once. And you have to recheck, as on the previous, the first lecture, as they said, the information have to be given in such a language that they will understand, and then to take the feedback and see whether they have understood what you have said or not up to that extent. And then you have to respond to the patient's reactions. And this responding should not make the patients uncomfortable. As example, the reaction is the patient is crying. And you obviously feel like giving a tissue. But you should not be giving a tissue, but just move the tissue box towards the patient so that he will take the tissue from the tissue box. And try to give all the positive aspects first, without saying the negative aspects. Cancer has not spread to the lymph nodes, but it has spread to some other places, but not to the lymph nodes. Maybe it is not in the lymph nodes, but to the adjacent tissues, it has gone. And it is not that you have to undergo radiotherapy, which has so much of complications, or chemotherapy, which has so much of complications, but this is highly responsive to the therapy. So if you give that information first, maybe the patient is ready to accept the next information. And the facts you have to do in an accurate and compassionate way, not to tell a lie to make the patient happy, not to tell the truth in such a way that the patient will get shocked, but it has to be going in the middle. Exploring the emotions, you have to give an empathetic response. Now, you heard about the empathy and empathetic response in the previous lecture. So, empathetic response has nothing to do with the sympathy. So, the difference between the empathy and sympathy, you have to clearly understand. Usually, we say, giving empathy is like walking with somebody else's shoes. So when you are walking with somebody else's shoes, what happens? Either you will, if you will not do it carefully, either you will hurt your leg or you will break the shoe. So you have to be very carefully. So for that, you have to identify the emotions expressed by the patients. This could be silence. So what does the silence mean? And the non-verbal clues, as Dr. Gamage said. And you have to identify the cause or the source of emotion, why this emotion has come up. When the patient is crying after you delivering the bad news, it might not mean that he is afraid of therapy or something like that, or he is that he is worried about his disease. Maybe he is worried about his children, what is going to happen to his children. So you have to identify the cause and then only response. So for that you have to ask questions. These questions are called Socratic questions, and maybe you can refer about that also. And you have to give the time. Don't try to deliver everything at once. You have to show them. Now, empathy is that you are showing them that you have recognized the connection between the emotion and their response. So, closing the interview is not just closing, but you have to schedule the next meeting or the further plan. As example, you should say, I will speak to you again when we have the opinion of the cancer specialist. So you have scheduled the next meeting. So that is basically how to break the bad news, but we'll just watch one video and see where and what is happening when you are trying to deliver bad news. Now, usually we don't speak to the patients in the corridors. There is a thing called doctor's busy gate. They just walk that way, but they don't even look at the patients. But in this situation, of course, she has talked to the patient, but then see what happens. Now, patients are quite advanced, and our attendants and the other staff are also quite advanced. They can read the reports, they can understand the reports. So now he already knows what is it. He is asking doctor, they make a cancer kagda. Now, even before the doctor has seen the report. So let's see again. See how doctor has answered. The patient is directly asking, doctor, is this a cancer? But the doctor says, it is very good that you came to me with this report. Now what would have happened if the doctor said, no, this is not a cancer, that is a lie. So after that she'll have to answer for that. So if she said, yes, this is a cancer, then see what will happen the next. Now this video was actually, this is not a real video. We have made this video in a office setup, but not in a ward even. But see what has happened. Just after you would have delivered the bad news, 2 attendants went and they were looking at the patient and listening what these people are saying. So if this boy has started crying and he is standing, he might faint and there will be a big issue. So doctor said, okay, good that you came. So the patient has asked for the second time whether this is a cancer. Then how doctor has responded.
ජයසිරි පුළුවන් ද තාපය භාගයකින් විතර මගේ කාමරේට එන්න. අපි මේ ගැන විස්තරයක් කතා කරමු. එහෙම හොඳයිනේ? පවුලේ කෙනෙක් හරි කාමරේ ගන්නවට කමක් නැහැ. පවුලේ කෙනෙක් හොයාගන්න නැත්නම් කවුරු හරි ඥාති කෙනෙක් වුණත් ළඟ කවුරු හරි කෙනෙක් එක්කන් එන්නකෝ. මේ ගැන විස්තරයක් කතා කරමු.
He is asking for the third time.
ජීවිතේ හැමදේම බරපතලයි. වෛද්‍ය විද්‍යාව දැන් දියුණුයි. ඉතින් බය වෙන්න කිසි දෙයක් නැහැ. අපි මේ ගැන විස්තරات කතා කරමු. පැය භාගයකින් විතර මගේ කාමරේට එන්න එහෙනම්. හරි එහෙනම් හරි.
So this is not a imagined scenario. This is what is happening usually. So he is asking for the third time also, doctor, is this a real issue? Barapatala deyakda. Doctor can't say no, this is not a big issue, but she has managed somehow to bring him down to the office because you have to make the setup.
That's it. මේක අපද?
මෙයා මේ බාපන්න.
බාපාම එකන් ආවේ?
පොඩි කාලේ ඉඳන් කරන අම්මලට ඉස්කෝලේ සමීපෙදී බා.
මට හිතුණා ඒක.
Sometimes we ask them to bring the closest family member. You have to bring either mother or father or wife or husband. When somebody else comes, we usually say, no, you bring your closest relative. I'm not going to tell it to each and every person. But sometimes the uncle could be the most closest relative. So you have to ask him, what is the reason for bringing this particular person? So
ඉතින් report එක නේ. ඉතින් ජයසිරි ඔයාගේ ලෙඩේ ගැන මොනවද දන්නේ?
ඇටෙන්ඩන්ට් උන්ට රිපෝට් එක අතරින් දෙනව ගන්න ඕන. කිව්වා රිපෝට් එක එච්චර හොඳ නැහැ කියලා. මට දැනගන්න ඕන පිළිකාවද ඒකද?
So he is asking again, and he is starting to cry. So usually doctors get upset at this moment.
මෙහෙමයි ජයසිරි. දෙයක් ගැන හරියට විස්තරයක් දැනගන්න නැතුව කලබල වෙන්න නරකයි. ඉතින් මේක එච්චර කලබල වෙන්න තත්ත්වයක් නෙමෙයි.
ඒක පිළිකාව නෙමෙයි තියෙන්නේ.
මෙහෙමයි ජයසිරි. අපේ ශරීරයේ පිළිකා සෛල ඇති වෙනවා නැති වෙනවා. මේක සමතුලිතතාවයක් එක්ක තමයි තියෙන්නේ. ඉතින් ඔක පාලනයෙන් මිදුනහම තමයි පිළිකා තත්ත්ව ඇති වෙන්නේ. ඉතින් ඒත් අද වෛද්‍ය විද්‍යාව ගොඩක් දියුණු නිසා මේ හැමදේම පාලනය කරගන්න පුළුවන් වෙලා තියෙනවා. ඉතින් මම ඔයාගේ රිපෝට් ඔක්කොම හොඳට බැලුවා. ඉතින් රිපෝට් එකට අනුව සුභාරංචියක් වගේම පොඩ්ඩක් අසුභාරංචියකුත් තියෙනවා.
This is what happens to us. Even though we are trying to deliver the news, now even in this video, the script was written not like this. Script was written that there is a good news and a bad news. But when this particular lady who acted in this, when she was trying to say this, she could not say that there's a good news and a bad news. So listen to what she said.
ඉතින් මම ඔයාගේ රිපෝට් ඔක්කොම හොඳට බැලුවා. ඉතින් රිපෝට් එකට අනුව සුභාරංචියක් වගේම පොඩ්ඩක් අසුභාරංචියකුත් තියෙනවා.
See, she can't say that asubharanchiyak thiyena. She says poddak asubharanchiyak thiyena. That is how the doctors usually do. But it has to be delivered in an empathetic way, without feelings, without sort of getting sympathetic. Say you have a good news and a bad news.
ජයසිරි මොකද සුභාරංචිය ගැන දැනගන්න
නෑ නෝනා කමන්නේ අසුභාරංචිම කියනවා.
මෙහෙමයි රිපෝට් එකට අනුව නම් පිළිකා තත්ත්වයක් ඇති වෙලා තියෙනවා ජයසිරි. මම ජයසිරි කලබල වෙන්න දෙයක් නැහැ. සුභාරංචිකුත් තියෙනවා කියලා මම කිව්වනේ. ඉතින් මේ පිළිකා තත්ත්වය පිළිකා නාසික සෛල ඖෂධ වලින් පාලනය කරගන්න පුළුවන් එකක්.
ඒව නේදරම ගත්තාම පිළිකානාට කවුරුද ගත්තාම නේදරම පොඩ්ඩ යනවා වම් යනවා කියන්නේ. ඒ අමාරු වැඩි කියන්නේ.
This is what patients are now. They know about the complications of the therapy even. So if you will try to explain all these things at this moment, it will be a very frustrating situation.
මෙහෙමයි ජයසිරි. ඔය බෙහෙත් අරගෙන පිළිකා හොඳ වෙලා පවුලේ ඇත් එක්ක දරුවොත් එක්ක සතුටින් ඉන්න ලෙඩු අපේ වාට්ටුවල හිටියා. ඉතින් අදටත් එයාලා සතුටින් පවුලත් එක්ක ළමයි එක්ක සතුටින් ජීවත් වෙනවා. ඉතින් අපි මේ වගේ සුබවාදී පැත්ත ගැන දකිමු නේද? ඉතින් පවුලත් එක්ක ළමයි එක්ක
The positive thinking.
සතුටින් ඉන්න එකනේ වැදගත්නේ. ඉතින් ජයසිරි අපිට පුළුවන් ප්‍රතිකාර පටන් ගන්න. අපි මේ රුධිර පරීක්ෂණ කිහිපයක් කරගන්න තියෙනවා.
කවදද මම ප්‍රතිකාර පටන් ගන්න පුළුවන්?
මම හෙට කියලා දෙන්නම් කොහොමද මේ ප්‍රතිකාර වලට සාර්ථක මුහුණ දෙන්නේ කියලා.
That is the follow up. You exactly say when you are going to talk. It's not that mama oyata passe kiyala dennan, not like that. මම හෙට කියලා දෙන්නම්. නැත්නම් අද මේ වෙලාවට කියලා දෙන්නම් ඔෆිස් එකට එන්න.
මේ පරීක්ෂණ ටික අපි කරගෙන ඒ ගැන සාකච්ඡා කරගන්න පුළුවන් හිට.
So I hope I have delivered some information about the communicating bad news. So hope you will not be afraid to deliver bad news. But of course, I know that when you go and try to deliver the bad news, you will again be in the same position, same uncomfortable position. But with the time, as Dr. Gamage said, like when you are talking to 250,000 patients, you will be quite fine. Don't worry. I hope that you will be able to do these things.